Welcome, Dr. Piggott. Great to see you. And we will get underway. So thank you all for joining us here today for the weekly COVID-19 situational update. Special thanks to our many guests that we have joining us today. I see MPP Dave Smith is here with us and Warden Jones. So would look forward to hearing any comments you might have to share once Dr. Piggott has finished his presentation. Also, special thanks to Dr. Lynn Mikkola, the Executive Vice President and Chief of Staff and Chief Medical Executive with the Peterborough Regional Health Centre is joining us, along with Dr. Kim Curtin, Medical Advisor with the Peterborough Family Health Team. So we're very grateful to have some representatives from our primary care sector here with us today. And also a special shout out to any guests who may be joining us through the YouTube live stream. We are just introducing that for residents. So if they want to join us live, if they'd like to join us live when we hold these sessions, that's now an option for people across the community. So to get us underway, let's take a moment to acknowledge the important history and traditions of our region. And I'd like to start with a land acknowledgement. We respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. All right, so as usual, we have opening remarks from our Board of Health Chair, Mayor Andy Mitchell. Welcome, Mayor Mitchell, please go ahead.
Well, thank you, Brittany. Last week, I said at our presser that I was frustrated and discouraged. This week, I am just simply troubled. Not because of what I know, but because of what I don't know. What I know gives me comfort. Vaccination rates continue to climb, and more local residents are getting first, second, third, and soon even fourth doses in long-term care. Yes, there is more to do, especially among our 5 to 11-year-olds. But progress is being made. Vaccinations work. The science table data from January 10th indicates that fully vaccinated people are 25.5% less likely to get sick, 77.4% less likely to end up in hospital, and 90.5% less likely to end up in an ICU. Our primary care system, as always, is stepping up and dealing with increased admissions, even in the face of staff absences. But it is what I don't know that is troubling. And I say this as a parent and a mayor responsible for the delivery of essential services. Is the risk of sending my children to school on Monday and possibly contracting COVID greater than the mental and emotional cost of staying isolated and learning remotely? Everyone seems to have an opinion, some very informed. But at the end of the day, it is a decision each parent has to make. And for many, it isn't an easy one. We ask, will the societal benefit to the millions of Ontario students of in-person schooling outweigh the inevitable impacts on those who are likely to get sick? Will in-person class lead to more infections in parents, increased absenteeism in workplaces, and create additional challenges delivering key essential municipal and other services? Do the changes in testing eligibility, amendments to isolation protocols, the limiting of case management to vulnerable populations, all brought about by the size of the Omicron wave, place people at increased risk? And where is the line between individual choice and collective responsibility? I wish I had the answers, but I don't. I am grateful, however, that Dr. Piggott and other MOHs are doing their very best to address many of the questions out there. It is important to appreciate that these are difficult questions, that people acting in good faith will often arrive at different answers, that discussions need to be about the merits of ideas, not the worth of the person expressing them. And to borrow a phrase from the warden, that we remember we are all in this together. Stay safe, be well, and in all things, be kind. Thank you.
Thank you, Mayor Mitchell. All right, let's have a look at our dashboard. So I'll now invite Dr. Piggott to lead us through these next few slides. Go ahead, Dr. Piggott.
Thanks so much, Brittany. Thank you. Thank you, Andy, and thank you everyone for joining us today. I'll take us through our dashboards, and then I'm going to talk in particular about schools, something that's on everyone's mind shortly. So this dashboard's current as of our 4 p.m. update yesterday. We have over 1,000 cases. Again, there is a significant underreporting with the focused PCR testing criteria. The local incidence rate of 418 is a slight decrease from last week's. And it's slightly below the provincial average. But sadly, this week we're reporting another 5 deaths that have come in, bringing our year-to-date total up to 10 deaths. And last night I did present some information on some of these deaths, an analysis for the Board of Health. So I'll share some of that information here. 6 of the 10 had the Delta variant. Whereas 4 were either suspected or confirmed Omicron. 4 of those individuals were unvaccinated. 6 had received vaccine, either 2 or 3 doses. The average age was 76 years old, but it ranged from in their 40s to in their 90s. And certainly of concern, the youngest individual in their 40s who passed away was unvaccinated. 7 of the 10 individuals that we have had pass away had passed away in hospital, and 3 in long-term care settings. It's really quite tragic to see these numbers increasing and to see this toll climb. And I offer my sincere condolences to the families of all those affected by these local losses in our region. Brittany, on to the next slide. We're sharing information from our partners at PRHC. As we've discussed before, with the focusing of testing criteria, one of our best indicators of what's happening is now the impacts that the health system is feeling. And so PRHC, as you'll be aware, is reporting 31 inpatients with COVID-19 and 3 current outbreaks. And we are working very closely with them throughout this to help support them and their continued efforts. And I'll share some thanks to them and our primary care partners shortly. On our next slide here, you can see the age breakdown of cases over the past 4 weeks. And this too emphasizes when you look at the under 20, how important it is for everyone in that age group, but especially the newly eligible 5 to 11-year-olds who are now eligible to get vaccinated. It's so important that we see people come forward in that group and get vaccinated. On to the next slide, we're dealing with 19 outbreaks in our community, up from 9 this time last week. You can see that we're no longer following outbreaks in the school settings in keeping with provincial guidance, and there are none because schools have been closed to in-person learning. And we are also now tracking and focusing our efforts on long-term care, retirement home, other congregate living settings, and outbreaks in First Nations communities. I know this is a tough time for residents and their families who are in facilities experiencing outbreaks. So my thoughts are with them, and our teams are doing everything that we can do to control and keep everyone in these environments safe. On to our next slide, you can see our wastewater surveillance data confirming that there continues to be transmission, and we'll have some more details and a deeper dive into some of the wastewater information at next week's press conference. On to the next slide, you can see that we've surpassed a really exciting milestone. More than 300,000 vaccine doses given. We surpassed that in the past week, and we're making wonderful progress. I want to mention in particular today we're doing walk-in vaccinations here at the Lions Club in East City. So especially if you're a teacher, school staff member, or childcare worker, I'd encourage you to come out to that this afternoon. If we go on to the next slide, the vaccinations for our entire population are strong, but we really need to up our coverage with the third dose because it is, it's very critical for protection. If we look at our next slide at the 70 plus, I'm encouraged that the individuals most at high risk of severe COVID are also the best covered with 3 doses. We still have some room to go, but very good progress there. When we look at the next slide around 5 to 11-year-old vaccinations, this is where I think we have the most progress yet to do. And I want to be here and answer questions and support parents around their questions with regards to vaccine, because I know some parents still have vaccine related questions, but I want to emphasize this is a safe vaccine. This is a vaccine we now know a lot about. It has been around for over a year, even though the newer child dosage and formulation, which is a lower dose, hasn't been around for as long. The vaccines for COVID-19 have been around for over a year, and they've been studied nearly more than any other medical intervention. Globally, nearly 10 billion doses have now been given, and all of that data is tracked and assessed so that we know that these vaccines are safe. We also know that they're very effective. So I know that with this number of only about 50% of kids 5 to 11 now being covered, there are still people out there wondering and with questions. We want to be here. We want to help and answer them, because I think it's critical for people to get this vaccination for their kids, for their protection, especially in the context of Omicron and how much transmission we're seeing. Okay, for my remarks today, I'll speak about schools and in-person learning, but I want to take a moment first to recognize our primary care partners and hospital partners who are present on the line today, especially from the Peterborough PRHC and from the Peterborough Family Health Team. And so I want to say a big thank you. Omicron has hit very quickly without warning. Our health system has had to ramp up their response incredibly, and I'm so proud of the work that they have done, both in supporting increasing vaccinations to the degree that we have here in the community, but also in their own capacity to respond to people who are ill with COVID-19. It's coming at a time when the hospitals and our health system was at its lowest and its most difficult time. As you've heard from the hospital, from the staffing challenges they're experiencing this week, it is a very difficult time for them. But I think their leadership is doing tremendous work to support the response and to continue to ensure people in the community are safe and continue to be able to access care throughout this difficult time period. So I really want to thank them at a time that I know is critically difficult. And I know that coming out of this time period, it's more critical to build up a stronger, resilient healthcare system after this experience in Omicron than the issue has been ever before. And they are here and happy to take questions related to this, given that the focus of a lot of our numbers and information now is more on the impact that it's having on primary care and the hospital. I want to talk about schools and in-person learning and provide some information for families, teachers, school staff, daycare staff, because I know that there is, like our board chair has said, a lot of trepidation and uncertainty amongst people. There's a lot of messaging in the media and in social media that makes this to be a black and white issue. Schools are dangerous, schools are safe. The reality, like so many issues, is that it's a gray area in between, and that it is a bit more complicated than just that. I think that when we look at risk, what's really important to understand is that risk is a formula based on the hazard of something and the exposure that somebody can have to that hazard. And risk is different for everyone. It's different for me, it's different for you, and it's a personalized issue. When we break down risk and we look at that hazard and the exposure, for kids, the hazard is lower. We know that kids are at lower risk of severe COVID-19 infection and hospitalization. As you can see on this image here, the rate of hospitalization is much, much lower. It's a little bit higher in the 0 to 4-year-olds, and that's a reflection of the fact that they haven't had the benefit of having the vaccine yet. And also, just even before COVID, we know that respiratory infections like COVID-19 tend to impact the younger kids a little bit more than older children. But you can see here, COVID-19 continues to be most burdensome on older adults. That doesn't mean the hazard or the issue here is none, and it's not that. And I don't want to minimize, because there will be people and there will be experiences where people will end up in hospital and have more severe outcomes, but the hazard is lower. You can lower the hazard even further by getting the vaccine. And so when we look at that, that's the most important consideration. When we look at the other part of that equation, which is exposure, I want to speak a bit about that, because I think that is where a lot of parental concern is perhaps coming from. We know that Omicron is transmitting higher than at any point in the pandemic before right now in our communities. That means that next week, as schools go back to in-person learning, there will be transmission. There will be cases of COVID in schools. We know that transmission's happening in a lot of other sites and in environments. And in fact, I think it may be lower in schools than in a lot of other places. If kids are playing in the basement or in the mall and they're not wearing masks and they're not in an environment, like schools have become so much safer with better ventilation, with access to rapid antigen tests, with improved and tighter fitting masks, and all the other measures that I know the school boards are working hard on. The exposure risk in schools may actually be lower than in a lot of other settings and environments. But again, it won't be none. But what we have to look at when we're talking about the risk is the balance of both of these pieces. And at the end of the day, it's parents and children who will be making these personal decisions, and I empathize with them. I know these are tough times. They're tough times to be a leader, to work, to learn, and especially tough times to be a parent. So I just wanted to share that. We want to be here and available for kids as well and their parents. And so this evening, we're hosting a session from 6:30 to 7:30 in collaboration with 2 neighboring health units and the school boards. So that is going to be broadcast live on YouTube, and the information's here. And we've taken a lot of questions in advance, and we're really looking forward to providing information for parents and kids as they're navigating this difficult time. But I do just want to say I really empathize with everybody that is going through this and these challenges and these decisions. Brittany, with that, I think I'll finish my remarks and obviously be happy to take questions. And again, thank you so much, everyone, for joining us today.
Great, thank you very much, Dr. Peggott. Okay, lots there. So before we move on to our media guests, I'd love to give our elected officials a chance to say a few words. Let's start with MPP Dave Smith, and I'm happy to spotlight you if you've got your camera working there. And please go ahead, MPP Smith.
Thanks, Brittany. I appreciate that. And I'm going to echo some of the comments that were made both by Dr. Piggott and by Andy. School is starting back up again on Monday, and I know that there's a lot of concern. We have parents who have reached out to our office telling us that we need to keep schools closed. We have parents who've reached out to our office saying that we should have opened schools on January 3rd, that we shouldn't have had any kind of a delay on it. And there's a lot of concern from a lot of different parents. My children are grown, so I'm not facing that same level of concern that others are. What I can say, though, is that we've had more than 70,000 HEPA filters installed in schools. Any classroom that does not have a mechanical HVAC system has a HEPA filter in it. Any school that has a mechanical HVAC system has had the filter system upgraded. So we're doing things there to protect kids to protect the staff and teachers. We've also installed, we're in the process of installing right now, 3,000
Oh, it seems like MPP Smith inadvertently left the meeting. Well, we'll certainly bring him back when he rejoins us. For now, though, let's hear from our warden, J. Murray Jones. I think you're on the call with us. Would love to spotlight you, and feel free to go ahead with your comments.
Okay, thank you very much. I certainly didn't want to be cutting Dave off. I guess he needs a better internet connection. Anyway, hi to everyone. I'll keep this short. I know you have some very important guests today, and we're all waiting to hear from them. Just a quick update from the county's perspective. Our administration offices are closed, of course. People are working from home wherever possible. Again, a big shout out to our paramedics and our public works people. They're out there in the trenches doing the best they can, and we're watching very closely our staffing levels. So far, okay, but we're keeping an eye on that. We're reestablishing our promotion about your urgency. Is it an emergency? And that's for the simple reason of trying to give a little break to our paramedics. We're telling people if it's not an emergency situation, look for other alternatives perhaps, so that we don't get ambulances running to the door. So if it is emergency, of course, dial 911, no question. But if everyone could keep that in mind. We're here and we're doing everything we can do at Peterborough County and all of our townships to support our public health people. Dr. Piggott, you're doing a great job. We really appreciate your leadership. I want to reach out and say a huge thank you to all the staff at the health unit, to the members of the board of directors. You know, the bottom line is we're all doing the best we can. We got to get the point across that we can't keep pointing fingers at people, blaming them for this or that or everything else. My goodness, we're all doing the best we can do. So let's be part of the solution and not part of the problem. And I also want to have a shout out to our local media. We tend to forget about them sometimes. But the men and women out there who are reporting on these things are doing an invaluable service. That's how we hear about the latest things we should be doing. So I want to have a little salute of the county cap to all the local media. Keep doing what you're doing. And as I usually say, we're all in this together. Thanks, everybody, and let's keep doing it.
Awesome. Thank you so much, Warden Jones. All right, I think MPP Smith is back, so I'm just going to put him back on the spotlight here. So go right ahead. Sorry about that. I think you were in the middle of updating us on the HEPA filter situation in schools.
Thanks, Brittany. I apologize for that. For whatever reason, the Legislative Assembly decided now was the time to force a security update on my my laptop. I was talking about the HEPA filters. We have them now in hallways. We have them in libraries in the schools. It is much safer. With the licensed daycare centers, we have 5,000 HEPA filters that have gone out to that. I know that there's a number of people who are concerned about it. I know that there's a number of people who don't know what the right answer is. And the right answer is whatever is right for you and your family. You can have your kids come back to school starting on Monday. But if you don't feel that this is the right time, you can also continue using e-learning as the solution. Those are the two ways of doing it. So whatever is going to be best for your family, that's the choice that you get to make, and we'll support you in it. I caught the end of what Warden Jones had said, and I think he's absolutely correct. There's a number of people that need to be thanked for all of the work that has been ongoing. The first responders here in our community, the individuals at the hospital, those who are working in Peterborough Public Health, everyone who is volunteering at the vaccination clinics. We owe a debt of gratitude to all of you and a great deal of thanks for all that you've done. This is a difficult time. I understand that. Omicron has presented us with some very different challenges that we didn't face early on in the pandemic, but we will get through it. We will soldier through. We will be in a better place as a result of it. I'll finish my remarks with what I have been ending all of my bingo shows with for the long-term care centers. Stay positive, test negative, because we're going to get through this together. Thank you.
Thank you, MPP Smith. All right, so let's move on to our media guests and the opportunity to ask questions. So just a note, we've got Dr. Piggott available, and also if there are questions for the primary care sector, Dr. Mikula and Dr. Curtin have kindly agreed to join us today. And we also have representatives from our enforcement partners. Inspector John Lyons is here with us from the Peterborough Police and Constable Joe Ayotte from the OPP. Okay, let's start with Matt Latour from Oldies and Freak Radio. Go ahead there, Matt.
I've got a couple questions. Both of them are for Dr. Piggott. You had mentioned, and this is more of a clarification than anything, you had mentioned 6 that were vaccinated of the recent deaths, correct?
Hi, yes, that that is correct. What's important to note when we're looking at data like that, though, is that the majority of people are now vaccinated. So the frequency of vaccination is so high, we would anticipate this. This is not surprising. And the fact that 4 out of these 10 were unvaccinated is a much higher rate, given that only about 1 in 10 people in the public are not vaccinated now. It means that it's a 400% more concerning situation in our own community for people who are unvaccinated, if that helps to clarify.
Yeah, my actual clarification was just when you say they're fully vaccinated, is that 3 doses? Is that still considered 2?
Most of those that had passed away had only had 2 doses. So 4 had had 2 doses and 2 had had 3 doses.
And you mentioned that some of them are suspected or confirmed Omicron cases. Is there any kind of growing fear that maybe Omicron is more severe than originally thought?
We're tracking that closely, as is the province and folks all around the world. I think that what continues to be apparent is that the vaccines are working to prevent hospitalization and death from Omicron, that it generally appears to be less severe. But what's alarming and concerning is, given that we're seeing so much more COVID out there, even with a less severe frequency of hospitalization and severe COVID, as I'm sure Dr. Mikula can attest to from the hospital perspective, we're seeing a far higher burden overall.
Wonderful. And I had one more question. This one, however, is for Dr. Mikula, if she's still on. And that I was just looking for an update on the ICU numbers at PRHC. I know when we had spoken on, I believe it was Monday or Tuesday, it was at 2. Is that still the case?
Yeah, thanks, Matt. So in fact, the hot off the presses latest numbers for the hospital are that we now have 32 patients admitted with COVID-19, and of those 3 are in the ICU with a COVID-related critical illness. I do want to emphasize these are by far the highest numbers we've seen in this community at any point in this pandemic. We've seen numbers approximating this in the past, back in the days when we were receiving transfers from other jurisdictions. This is a large burden of disease, a very large burden of disease for our community. And we're certainly experiencing the weight of that in both primary care, acute care, and all other arms of the healthcare sector.
With a lot of the projections kind of see Omicron plateauing in the next few weeks, is there still, the capacity for the numbers to keep going up locally, or is it pretty close to capacity?
That's a good question. There's a lot of planning going on both locally and regionally and provincially to use the capacity that we have as efficiently as possible and to create additional capacity. As we discussed on, I do think it was Tuesday, our biggest constraint is in fact staffing, not space, not physical beds, not rooms. It's having staffing. And so that is one of the main efforts going on in the healthcare system. It also fluctuates a lot, though, because our staff are being exposed, going off sick. They're subject to all of the same risks that members of the general public are when they're out and about living their lives. And so the impact that it's having on everyone, it's also having on our staff. So day to day, our constraints in terms of staffing change, and that's something that we have to manage, with every shift, basically. So it's not an easy question to answer in absolute numbers, Matt.
Dr. Mikula, Dr. Piggott, thank you. That's all for me.
Great, thank you so much, Matt. Okay, let's hear from our global news representative. Jessica Niznik is here with us. So if you've got some questions for Dr. Piggott or the other speakers, please let me know.
I do. Thank you, Brittany. I have some questions for Dr. Piggott to start.
Okay.
Dr. Piggott, it took us about 2 years to get to 30 deaths in the region, and now we've shot up, a lot in the last few months. What do you think is going on? Why a rise in deaths when more people are vaccinated? And it just seems to be happening so quickly now. What do you think is going on?
Well, we similarly are concerned. With numbers, there can always be the potential for fluctuation and just a bad chance, a bad run of a series of deaths. At this point, we haven't been able to find any underlying links other than the fact that the rates are much higher among those who are unvaccinated. We know that this is happening across the province as well. Now we have seen an increase in the number of deaths. So at this point, there's nothing that I can point to and put our finger on that we're doing necessarily wrong. What I do want to say is I think that this region had done particularly excellent earlier in the pandemic with low rates of death, especially in our long-term care homes. And I think there was great medical oversight and healthcare leadership by those long-term care homes and our hospital earlier in the pandemic. I'm not sure if somebody else, perhaps Dr. Curtin or Dr. Mikula, who's been here a lot in the region longer than I have, wants to add or comment on that. But it is concerning. We're keeping a very close eye on it to see is there anything that needs to be done as a result of this trend and what might be underlying it.
If I may, I'll add that I think this is largely a question of math. We have never seen even close to this number of infections. And even with a large proportion of the population being vaccinated, there are so many cases out there that if you just do the math, even with a smaller percentage of deaths, these numbers are going to go up in the way that we're seeing. And that's certainly the experience that we're feeling at the hospital. The long-term care homes continue to do a fabulous job of protecting their residents, protecting their staff. But again, we're all subject to the same mathematical pressures now. There's an awful lot of COVID circulating.
Thank you. The next question I have is about PCR testing. So maybe that would be for you, Dr. Mikula. There still seems to be a lot of confusion around who can get tested. At first, we were told it was for people who work and live in high-risk settings. And now it seems I've heard teachers are going and they're able to get tested. I had to know of someone, a teacher who got tested at PRHC. So when I looked at the website today, the Ontario website, it did say teachers are on it. So did that change recently? And maybe we could just go over a quick who is eligible for testing and why.
So I can certainly start. The eligibility criteria, unless something's changed and I don't know it, have not changed. We are still testing people with moderate symptoms. So people who don't fall into any of the high-risk categories who have moderate symptoms can come for an assessment, and based on the judgment of the physician assessing them, can receive a test. Other than that, as far as I'm aware, it's still those high-risk criteria, people who work, live in high-risk settings, people who live in First Nations communities, and all the others that are posted on the website. And I'm sorry, I don't have them in front of me to rattle off, but I don't believe anything has changed.
Okay, thanks. Yeah, I can look in the website and find out. I guess it's just when the messaging first came out, it was, as my understanding, the general public couldn't get tests anymore. And then when you mentioned Tuesday that people with moderate symptoms, it really did confuse me and the rest of the public. So, because as I knew, like I said, it wasn't for the general public anymore. But so now you're saying moderate cases can still get tested.
And that has been the case all along. And I know it's certainly been, the shift was abrupt and the shift was confusing, but people with moderate symptoms can call their physician, either their primary care physician, or call the assessment center, and they can come in for an assessment. And again, if the treating physician deems it appropriate, we'll do a test. And the website, I believe, is ontario.ca/exposed. That will give you all of the criteria that we're using to guide who does and does not qualify for a PCR test.
Okay, thank you, Dr. Mikula, and thank you,
And if I
Dr.
can,
Piggott.
yeah,
Go
and if
ahead,
I
Dr.
can,
Piggott.
I'll add to underscore what Dr. Mikula said. And there hasn't been changes yet to the new PCR testing criteria. What the public may be reading into and confusing with is that there continues to be PCR self-collection kits available through schools. That is a legacy program while supplies last. And that's for symptomatic individuals, and the school boards would be the best point of contact for that. So that may be how that access would happen. And the other thing I want to say is that this is all in flux and changing. These decisions and the prioritization were as a result of the significant volume of tests with how widespread Omicron was and the need to focus in on the highest risk populations. This may again change into the future as the pandemic continues. But Brittany's just put into the chat, and the best resource for folks to consult for the most current information is the ontario.ca/exposed website.
Thank you both. I appreciate it. That's it for me.
Thanks, Jessica.
Thank you, Jessica. Okay, and thank you both for your answers. Okay, let's hear from our examiner colleague. I see Reg Watson is here with us today. So if you've got some questions, Reg, please go ahead.
I'll defer to Bill Hodgins.
Okay, great. Then let's hear from Bill. If you've got some questions, Bill, go right ahead.
Yeah, for Dr. Piggott. Well, first, hey, a shout out to Warden Jones. Thanks for the immediate shout out. That was much appreciated. Yeah, I'd like to focus a bit on the 5 to 11 vaccination rates. It seems to me that it's kind of stagnated. Have you heard of any jurisdictions that, I don't know, maybe have offered any unique incentives, or do you think mandates might be an issue for that age group?
Well, we generally know that mandates are effective in improving coverage. Ontario has something called the Immunization of School Pupils Act that mandates vaccines or a verified exemption process for school children for a bunch of other diseases. And I do think that this is an important consideration to make schools safer and to increase the coverage. At this point, though, we are locally doing everything we can to just reassure, provide more information, and support parents and kids in their decisions. One thing I will say is with the changes that are happening provincially and locally with schools, there will still be a role that public health will be playing, working with schools and looking at the risks that individuals may have if there are COVID cases and we're seeing increasing absenteeism. And so it could be that there will be direction from public health that people who are unvaccinated will need to stay home for a period of time if it appears that there's transmission happening in the school settings, and that will be in order to protect themselves. So I think that probably answers that. I'm going to be available this evening and we'll be talking about vaccines as well as schools more broadly. And we're trying to do everything that we can to make ourselves available and support schools, parents, and kids in getting the information that they need to know what we know, what I know. This is a safe, effective vaccine, and it's going to be critical to saving lives and really keeping kids healthier.
Thanks. And your Twitter thread last night was really helpful too. One more question. With Omicron just exploding the way it is, have you seen any, has the health units noticed any increase in the vaccine hesitant, the ones that have been hesitant all along, maybe coming forward now?
I mean, there is always some low-level background noise of concern, but as I've said, it has become a very marginal, small group of vocal individuals. And overwhelmingly, I'm looking to the nearly everyone in our community that's on board and supportive of this vaccine.
Excellent. That's it for me. Thank you.
Thanks, Bill.
Thank you, Bill. All right. I'm going to suggest that we hear from Paul Rellinger, and then we'll get to Taylor Clydesdale. So Paul, if you've got questions for Dr. Piggott or other speakers, please go ahead.
I do, Brittany. Thanks so much. A couple questions for Dr. Piggott, and if I could for Dr. Mikula. Dr. Piggott, seems everybody has an opinion on it, and I wanted to ask yours because it's very much in the news. The vaccine tax in Quebec. A lot of controversy. Can you offer an opinion on that? Your thoughts on, is it a good idea, too soon, or are we at that point? Is it something you would support?
Yes, I can offer opinion. I think that mandates and restrictions and incentives and measures that link and support vaccination are effective, period. However, they always have to be balanced and you have to look at the potential consequences of them. One of my concerns with a tax on people accessing healthcare is that then they don't come and seek healthcare. We know this for people who don't have OHIP coverage and who stay home until they're sicker and come to the hospital late. That costs the system more money, but it also has a harmful impact on people's life. So I wouldn't want us to disincentivize people coming to school, but I think we need to normalize and incentivize vaccines more broadly. Maybe a tax break or a tax cut, maybe other measures and incentives. I think ultimately each of these settings and decisions around vaccine requirements, whether it's in schools, in businesses, or more broadly in society, need to be balanced with the potential consequences they have. But the more that we do normalize and require vaccination, the reality is the higher the vaccine coverage.
Thank you. January 26th, which is less than 2 weeks away now, is the date that's been set by the Premier to review the current restrictions, whether they stay in place or whether they're heightened. Totally unfair question, and I apologize, but the way we're tracking right now, do you see that as being realistic? Is that achievable, attainable?
I think every time there are public health measures put in place, there's a time period that they'll be reevaluated in because the setting and context can change. I think what we've been told by the Ontario Science Table and looking at the modeling is that Omicron is going to continue surging well through January and February. And so I think that will no doubt need to be considered and balanced with the potential consequences that continued lockdown measures are having on people, on families, on businesses, and on our communities.
Thank you. And one more question, Dr. Piggott, if I could. We've heard much about how Omicron has put a burden on staffing for many different organizations. I know the city and certainly the hospital is dealing with that as well. Very important people right now in the way things are playing out are the people who are working the vaccine clinics. That not only includes PPH staff, but of course the volunteers. Any worry that there could be an erosion of staffing capabilities at that level at such a critical time?
Working hard to avoid it. I am constantly worried about that, but we're doing a lot to try to mitigate that. We're up staffing and trying to ensure that we have more staff that we can account on potentially if there's absenteeism, still having enough people. We're trying to provide and utilize rapid antigen testing for those staff and for those contexts. We're using tightly fitting masks and protection measures to encourage and ensure people are as safe as possible when they are at work. But we will continue to follow and assess the situation carefully. And I do anticipate there will be some challenges, but I know our teams are planning and we'll be able to get through those. And I will just pause because I know Dr. Curtin has her hand up and perhaps wants to add or contribute to that, because this has been a great collaboration between public health, between primary care, our pharmacies, and the hospital. All the partners are doing a lot of vaccinating work.
Yes, and just one example of that is in terms of how much the community has stepped up to assist with this vaccination project for an entire year now. You know, despite everyone else's work and stress and family worries, and just last week or the week before, when there was a call out for vaccinators to come to an additional pediatric clinic at the Healthy Planet, organized between Family Health Team and Public Health. Within less than 24 hours, they had 38 volunteers for vaccinators. So these are people who've already given up their time, but the community has really stepped up to vaccinate. So in terms of shout outs, that goes to, of course, the volunteers as well. But nurses and pharmacists and physicians have really come forward to vaccinate our community.
Well, that's very impressive. Thanks for adding to that answer, and thank you, Dr. Piggott. I appreciate it. Dr. Mikula, I know one thing that a lot of people are looking for right now, besides an end to the pandemic, is simple reassurance. When we look at the hospital situation, what can you tell people about the hospital's ability to see urgent cases as they always have and to be able to respond quickly? For example, someone has a medical episode at home, serious, is rushed to the hospital. Can you reassure people that they will be looked after in as timely a fashion as ever?
I can, and it would be my pleasure to reassure everyone that we are still here for you at the hospital. If you need us for urgent or emergent care, if you need to come to the emergency room, we are absolutely open, we're running, we are here to look after you. We have, in alignment with the recently released Directive Number 2, we have ramped down our non-urgent and non-emergent procedural services. But this is in the service of making sure that we can continue to offer urgent and emergent care. So the hospital is still functional. Our staff are tired, but they are still on their feet. They are still here to care for you. I'll take a moment to just thank them again for the unbelievable work they've done over the last 2 years and that they continue to do. But our staff and physicians are still here, and the hospital is still doing what it needs to do. So absolutely, I am happy to offer that reassurance.
Thank you, Dr. Mikula. I was pretty sure that would be your answer, but I do think people need to hear that. So thank you. Thank you, Dr. Piggott, and thank you, Brittany. That's it for me.
Okay, great. Thank you all. Okay, so last but not least, we have Taylor Clydesdale, who's joining us from Peterborough this week. And I believe you have a few questions on vaccine mandates for Dr. Piggott. So go ahead.
I do, and thank you. Actually, if MPP Smith is still in the call, if I could maybe leave with a question or two for him.
Okay, let's see here.
I am still here, yes.
Okay, perfect. Yeah, Dave, I was just wondering about, there was some talk from the federal health minister about expecting that provinces might eventually pass expanded vaccine mandates. What are your thoughts on the idea of expanding it so that healthcare workers, teachers, students, other populations that don't currently have to be vaccinated to go into the workplace or into schools might have to in the future? Is that something that the province is considering?
Taylor, I'm not a medical expert, so I can't give you an informed decision on whether or not it's a good idea to mandate vaccines for anybody. I think that's something that we would have to get good, solid advice from all of our medical experts on which way would be the best way to go with it. At present, we are not having a discussion about this. As I said, this is something that we would have to get good medical advice from the Chief Medical Officer of Health, all of the medical officers of health, as well as the entire hospital network.
Okay, and then my second question for you is just, leaping off of earlier question about Quebec. I was just wondering if you had any thoughts that you wanted to share about that situation and that development.
I'm focused on the health and well-being of the people of Ontario. What Quebec does is something that Quebec does, and I would leave it up to Quebec to decide on how they want to operate within their own province. Here in Ontario, we're looking at what's in the best interest of everybody in Ontario, what's in the best interest of the health and welfare of everybody in Ontario.
Okay, that's it for me to you. I'll move on then to Dr. Piggott, if that's all right. Yeah, basically more or less the same line of questioning for you. I know we've already had some conversation this session about mandates, but I'm just wondering if you had any thoughts about potentially expanding requirements so that teachers, students, healthcare workers, should they be vaccinated before they are allowed to continue working in the workplace?
Yeah, thank you for that, Taylor. And I mean, I think ultimately they are challenging policy-oriented questions that the province will no doubt navigate. Like I mentioned earlier, requiring vaccination improves uptake of vaccination, clearly. We know that from across a number of settings and jurisdictions. We know that this vaccine is safe. We know that some people, when a requirement for vaccination is put in place, actually feel a sense of relief because it does, in a sense, take away that uncertainty or hesitancy they may have because it is required. We know that these vaccines are safe and effective. And so I think that there will no doubt be more consideration to that in the coming days and weeks. And I think that there are important considerations given how critical it is to have vaccine coverage be as high as it can. And I know and I empathize with, the 90% in our community who are vaccinated and who do feel anxiety and feel uncomfortable that there are still individuals potentially around them who haven't made that decision to get vaccinated yet.
Are there any efforts being made right now to push for vaccination among those who are hesitant?
While we are doing loads of education and supports, we're answering all kinds of questions, including for parents and kids this evening. For the year plus that we've been rolling out this COVID-19 vaccine and the decades of public health that preceded it, we've always been working on this issue and helping people who are hesitant to understand the science and the importance of the protection of vaccines. And so we continue that work.
Just in the question of, and maybe this is in theory, but if greater restrictions did come down, what about people who medically cannot be vaccinated? I know for a lot of vaccine policies in the workplace, it's a lot of if you cannot be if you cannot be vaccinated, you have to provide proof of medical exemption and regular testing. Is that kind of something along the lines of what you would recommend if there were greater vaccine mandates for other institutions?
Yes, so there are extremely few and limited true medical exemptions and reasons not to get the COVID-19 vaccine. They're overwhelmingly well tolerated. Of course, we always need accommodations and consideration of that. The nice thing about the COVID-19 vaccines are that we now have a suite, multiple different vaccines available. So if somebody for a medical reason isn't able to get one, then they may be able to get another. And so I know our team, and especially primary care and doctors are working to make sure that people can have alternatives if for some reason they are unable to get the vaccine. But it's an extremely rare situation actually now that there's a genuine medical reason for that.
Do we actually know what percentage of the population is truly medically exempt and cannot get any form of the vaccine?
I can't answer that question today. It would be a small proportion of the population. We may have that data coming into the future because there's a process underway to register those medical exemptions, and we may have more information in the coming weeks or months as we're able to tabulate and understand how many. But I can tell you in our region, our community, it's a fairly small number.
Okay, perfect. I think that's it for me. Thank you very much, Dr. Piggott. I appreciate the help.
Thanks, Taylor. And thanks to all our media, as the Warden Jones had mentioned as well.
Great. Thank you, everybody, for your comments today. I believe that brings us to an end to our to this week's update. So again, I appreciate having the great contributions from our primary care sector, Dr. Mikula, Dr. Curtin, and thank you also to the warden and MPP Smith for your comments. So with that, look forward to seeing you back here next Thursday at 12 noon. And for those of you keen to find out more about the back to school situation, please do join us tonight for the presentation that brings together all of our local health units with HKPR, Durham Region, and Peterborough Public Health. You can find the link on our webpage or just go to the HKPR YouTube channel listed on this slide below. Okay, thank you all. Stay safe out there and take good care.
Thanks, Brittany.
Thank you, everyone.